really quickly thank the entire OT department, as well as Heather, Dan, and Stephanie. I'm going to try to speak as quickly as I can, but of all people, Stephanie should be the one who knows that it's almost truly impossible for me to tell even the most minuscule story within a 5-minute time frame. But nonetheless, I wasn't prepared to pass up the chance to come out to Las Vegas, even if it meant going back to college. I suffer from ADD on a daily basis, and I often go into tantrums that have nothing to do with the topic at hand. And while I was preparing this speech, I was continually going off into aspects that had nothing to do with the subject matter. So I was trying to figure out a way that I could verbalize when this was happening. And that's when I thought back to the writings of the great philosopher Friedrich Nietzsche, or Friedrich Nietzsche, or however you decide to pronounce his name. And how, if you've ever read anything of his, you know that he really must have had some ADD happening. And that's when it hit me to coin the phrase Nietzsche moment. So going forward, if I get way off topic, it's going to be a Nietzsche moment, and then you'll know. We'll be together. Everybody has a different story, though, a different experience, a different level of emotion that comes with amputation. Everyone suffers from different physical, emotional, and sometimes invisible or perceived pain, which was the description I found when I Googled phantom pain. It's not that I'm not well aware of what it is, but like any young collegiate scholar, I wanted to be well prepared for this presentation, so like many of you do, I went straight to Wikipedia. And according to that ever valuable resource, phantom pain is described as perceptions that an individual experiences relating to a limb or an organ that is not physically part of the body. Now, if you search for the definition of perception, among other variations, you'll find the neurological process by which such recognition and interpretation are affected. Now, you're probably wondering where on earth I'm going with all of this. You were ready for a story, not English class, and I'm not going to bog you down with definitions, but I did want to preface this by saying that I think Wikipedia is slightly off. When you have your first experience of what you swear is a butcher's knife stabbing into your big toe, that's no longer there. The words that fly out of your mouth are validating enough to know that it's a very real feeling and not just some perception of chance. And that was a Nietzsche moment. I'm going to condense the story of how I lost my leg in possibly the shortest passage I've ever shared. I was in Florida in August of 2006, coming home from Florida to North Carolina. We were going down 95 North, me and my old roommate in a minivan, and it was pouring down rain, the type of rain that makes you ponder what you did to take Mother Earth off this much. But then that pondering went out the window because I went out the window. And that's when I finally realized what a guardrail could do. But to ease your mind slightly, it wasn't as crazy as the imaginations are taking you to. It wasn't, my leg didn't fly off and go down the highway. It was just mostly severed. But after waiting 20 minutes for the paramedics to show up, I took a $10,000 helicopter ride to the hospital, camped out there for the next 2 months, and 16 months later, I opted to have an elective amputation. Which, for the record, I hate the word elective amputation, but I won't get into that. I think the most common question I get from people who hear my story is, you know, what did you feel? What was it like when you first woke up and you didn't have a leg? And what I've come to find is, for me, as well as many other people who opt for amputation, it was a huge sense of relief. It was almost like a heightened sense of relief, almost like a high. But that's when I realized the nurse was administering Dilaudid IV push every 3 hours, so it really was a high. But unfortunately, the nurse wouldn't let me take any of it home, and so the next day, after all of it was out of my system, that's when I had my first experience with phantom pain, and what a bizarre, bizarre feeling. And then came the pills. Pills, 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 pills. I tried everything, and I think my favorite was Lyrica. I don't know what the recommended dosages for Lyrica are, but my doctor had me taking 150 milligrams every 4 to 6 hours. And while it worked, I couldn't feel any phantom pain. I also couldn't feel anything else. Nothing. It was like I was floating around. So like all the other pills, that came to an end as well. And then finally one day I was seeing my prosthetist, and he mentioned this mirror box therapy thing and how it works, and He described the theory behind it, and I in turn asked him where on earth he went to college, because being I don't know, I'm such a logic-based person, like A plus B has to equal C, and I just couldn't grasp it. But it worked. I couldn't imagine myself going to a craft store and getting mirrors in a box and trying to treat something that is beyond my imagination, but it worked. Not only did it work, but it worked instantly. It was a miracle worker. And I would only have to do it a few minutes per session, and my brain would be really confused, like, what the heck, why are there two legs here again? So once I found this simple method, I began using it daily, as I absolutely needed to. But then it became more or less habitual, and I started questioning if I actually needed to use it. Because outside of the occasional lightning strike to the ankle, I wasn't really having that severe raw pain that kept me in bed all the time, not allowing me to do anything. And then finally one day I just stopped using it. And now if I have one of those days, if I have a bad day, I'll just lie in bed and envision myself using this technique, and it works just as well for me. But I can say, as an amputee for the past 4.5 years, it's definitely been the best thing that I discovered as a treatment for phantom pain. Outside of all the medicines, I mean, it's simple, it's cheap, it's easy, and it worked. So I definitely would recommend it, and stay away from the Lyrica. Thank you.